Welcome to another episode of Boomer Health at Home, the show where we provide you useful information to help you and your loved ones live a happy, healthy life. I'm your host, Brett Pulte, and today technology has grown so much over the past few years, and recently we've seen more products come out that are designed specifically for older adults. So joining us today to discuss some of this new technology is our friend, Registered Nurse Joyce Ward. Joyce, thank you for joining us today.
Oh, it's my pleasure. Thank you.
Oh, of course. It's always great having you here. So you've been on the show a few times before, but can you give us just a brief overview of your credentials?
Yes, I'm a Bachelor of Science trained nurse. I am also a liaison, care transitions liaison for Beaumont Health and Oak Med, private duty nursing. And I also am a licensed chiropractor as well. So I've kind of got a varied background.
A little bit of everything.
Yes.
So, our topic today is technology for boomers, and, like I said, we've seen more and more companies coming out with products aimed at an older generation. Why do you think these companies are putting these products out?
Well, definitely economic opportunity.
Well, of course, the more money, more money.
See an opportunity there. Especially, and speaking from somebody, I'm 63, so I did not grow up with technology, as most people my age kind of came into it later in life. And, it does make a difference, and it's somewhat intimidating. And I think there's definitely a marketing opportunity to take the technology and simplify it for ease of use of older people, and kind of keep them connected in the electronic world.
Yeah, and it's, we recently got my father a smartphone, and this is a guy who's only worked on cars his entire life and has no idea how to use a computer, but he does pretty well.
Yeah,
He does pretty well, I'll give him that.
Well, the technology is definitely getting, I don't want to say dumbed down, but it's getting more simplified so that you don't...
User-friendly.
Exactly. Yeah, and a little more intuitive. So, and for an older person, there's particular needs that need to be addressed, vision and hearing and those kind of things. And I think these have done a great job in helping keep people within the information technology world.
Oh, of course, yeah. And it seems that, families are being spread further and further apart these days. How does technology keep them all connected?
Well, there's so many things that you can do now to stay connected with an older person. There's, Alexa and all the Echo Dot and all the different things, and there's a lot of private network kind of tablet devices and stuff where these people can have face-to-face time with family members, and they're dedicated use items that the person doesn't have to go on the computer and try and hook up with different apps and that kind of thing.
Yeah.
It's very self-contained.
A little easier to be on the couch rather than having to run off, grab a computer.
Exactly, exactly, yes.
So you mentioned, having face-to-face time, and what type of health benefits are associated with being able to see someone's face in real time as you're talking to them rather than just on the phone or, having a picture of them? Yeah,
well, obviously visual and audio connection gives the feeling of an in-person visit, and that you have that real connection, and sometimes you can read things into people's voice and inflection and facial expressions and so forth that you wouldn't be able to see over hear on the phone. So it's an emotional connection that's intensified. It's just as if the person was sitting in the room with you. So it's much more gratifying, I think, to people to visit that way rather than have just a letter or a phone call or something.
Yeah, and my brother lives in Georgia, so my mom and him do a lot of video chatting, and my mom says it's just good to see him, know that he's okay, that, he's healthy.
Right, I know. And my only grandchildren live in Texas, so we do that, Skyping all the time, and I just get to see them change and grow on a weekly basis rather than, seeing once a year or something, and and really being a part of their lives, you know, and having them know me. So
of course, and that's one of the big things too. You know, recently having a child, my brother and I mean, maybe in the past 10 years we've video chatted 3 times. Over the past month, it's probably been 5 times.
It's amazing what those babies can do.
Babies change a lot.
yes.
So, what are some of the products available for seniors that can help them stay connected with their families?
Oh, there's so many of them, and it seems like a new one comes out every day. They're really marketing, you know, around Christmas time and stuff. But there's Google Home Hub, Amazon Echo View. There's, you know, of course, FaceTime, Facebook video chats. GrandPad is a new one that they've been pushing by Consumer Cellular, which is kind of a neat product.
Yeah, and you know, GrandPad, I love that name. I think that is one of the best marketing names that I've ever heard.
Yes, marketing gold.
And then, you know, the product itself is really great too. You know, what benefits does personal technology have for our baby boomer generation?
Well, in a lot of cases, the baby boomer generation is seniors can tend to be isolated, especially, you know, older. My mom is 94, lives with me, and would never be able to use a computer or anything like that. And in the case of, I was looking at the GrandPad to get that for her, but what's nice is it's large. The tablet's large. She can see it. She has visual acuity problems. And it's self-contained. It's on a private network. So all of the family members spread all over the country just download the app. And it's on a private network, which I'm concerned about, you know, her going online, and who knows who would call her or try and get her information or whatever. So it's kind of a built-in protection in that particular product. You know, but if you're more, and now there are some 90-year-olds that are awesome on the computer. So there's, you know, that level all the way up to, you know, quite actually advanced levels of products for people. But it's just having that connection, group chats, those kind of things. It's like having a family reunion every day. So it's pretty awesome. That's
really cool. And, you know, like you said, it's on its own private network, which means that, you know, she can't get out, she can't share information.
Right.
And I remember before technology got big like this, we had issues with my grandmother giving her social security number over the phone to anyone that would call.
So, so
I know. I totally get the want of security for that. So, I mean, we're all carrying around smartphones nowadays, and they can do so much, but what are some things that our phones can do to improve our overall health?
Oh, there's just some really awesome products out there. Recently, they've been advertising an app on your phone where you can do your own electrocardiogram, EKG. So you'll know. And this is especially important for AFib patients, atrial fibrillation patients can take that, and they know that they're in AFib and they have to contact their doctor because that could be an emergency situation. You can track your blood sugar, your activity levels, all kinds of things that can be done through apps on your smartphones these days. So
and it seems like there's something new all the time.
Every day,
always coming out.
Right.
You know, previously we did a show on wearable technology like watches and things. What are some of the products available to help medically that a person can purchase that's a wearable technology?
Right. There's the Apple Watch Series 3. You can leave your phone behind altogether. It streams music. It'll take your calls, track your runs and heart rate. Can track your swimming workouts and all kinds of things. It can do. It's an amazing app. And then there's Samsung has the Gear S3. It works with the iPhone as well, and it can track all of your health metrics. It comes in different versions: sports version, fashion version. You know, some are waterproof to go swimming with them. So then there's a Motive Ring. This is an actual ring that you wear right on your finger, just like your wedding band, and it's only 0.1 inches thick, and it's waterproof.
Yeah.
And it tracks your sleep patterns, heart rate, fitness activity. It's pretty new, so I'm not a big one for buying technology when it first comes out. But yeah, sometimes that's not done yet.
Yeah, and I had talked to my wife, about different wearable technology. She has a Fitbit watch that, she just kind of has to have, essentially.
Right.
But the Ring one, that always kind of interests me. And I mean, my wedding band is fairly bigger than most, and I'm thinking 0.1 inches thick. That's probably thinner than what I wear.
Yeah, it's amazing how small they
can pack all that stuff into it.
Right. It is amazing.
Yeah, and many medical providers are offering online options for viewing your medical records. Can some of these products help with viewing the medical records?
Yes, they can. It depends on how well set up your provider is. The doctor has some leeway in investing in technology, but definitely a possibility.
Oh, good.
You'd have to check with your individual provider to see how they interface with these different items.
Yeah.
And again, it's developing technology, so pretty soon I'm sure it'll be pretty seamless.
Oh, and it's like we've been saying this entire show. It's something new every day.
Yes, yes.
So we just mentioned online medical records, and there's a big thing about cybersecurity now and security all over. So are your medical records online treated with the same security as your physical records?
Yes, the HIPAA Act addresses that with very specific guidelines that they have to have. And but again, as we've talked about before, there's always a way. They always figure out a way to hack or get data breaches. If somebody really wants something and they have the knowledge to do it, they can get it. So that's why it's very important to monitor your records all the time. And if there is a data breach and the holder of the records is aware of it, they are required to notify you immediately as soon as they find out. So
yeah, it's just like we saw last year around this time that Target got all their credit card information taken of all the payments they had. So it's kind of the same idea with medical records. It's out there. Someone could do it.
Right. That's always the risk, with anything. But I mean, they could get your paper records as well too if that came down to it. So it's a risk anytime information is recorded somewhere in any format. Somebody can get it if they try hard enough. So you have to watch out for yourself and take some personal responsibility for safeguarding your information.
And like you said, safeguarding and personal responsibility. What are some ways that a person can digitally store their own medical records?
Well, you could download them directly onto your computer, but if you did that, I would recommend that you have the latest updated software to protect yourself, virus protection, and so forth. You might want to store it on a separate device that's not accessed by your computer system, a jump drive or a separate hard drive to store those kind of things on, that you connect to it when you want to and not have it always running through the system. Yeah,
it's kind of like, everyone has one password for everything, except banking information is always different.
Right, yes.
If someone wants to get into my emails, go right ahead. That's fine. But you stay away from my bank stuff. That's totally different.
Yes.
Now, are there products out there that can help you keep your records safe when you transport them, like between doctor's offices or a new care facility, anything like that?
You might want to consider printing it, or I probably personally wouldn't want to transmit because I don't know what kind of system the doctor's office has or how up to date it is. You could take it on a thumb drive. There's a number of different ways
and have them do it in-house rather than going over the internet.
Exactly.
Okay. That's definitely a good piece of information there. What type of security do doctors' offices and other medical facilities have to protect all of our medical information?
They're pretty specific about what kind of firewalls and so forth they have to have, and data breach detection software and so forth. That's very strict, and the providers are very well motivated to do that because for each data breach, they can be fined up to $25,000.
Wow.
And there's actual prison time associated with it if they're found to be negligent. So they are required and are very motivated to try and do the best to keep your information safe.
I mean, it's good that we have laws that actually enforce that and have stiff penalties because, I mean, if I'm a doctor and I could be facing jail time because I didn't protect someone's information, I'm going to protect everything I can at that point.
Right.
So in the same vein of technology, we've heard new strides being taken with telemedicine. Can you explain to us what telemedicine is?
Telemedicine is basically kind of a FaceTime with your doctor.
Okay.
It's a virtual doctor's office visit.
Yeah.
And depending on the different states govern with different rules, but you can actually, some technology, I know when I used to be in home care, they had a blood pressure cuff attached to a dedicated monitor where you would sit face to face and it would take your blood pressure, heart rate, all that kind of stuff. We use that for our congestive heart failure patients. So technology's been there a long time. That was 15 years ago. So nowadays, I mean, there's doctor on demand and a number of other virtual. It's kind of an untapped market at this point.
Yeah.
There's a lot of state regulations that impede some of that. Technologies, particularly when it comes to writing prescriptions and so forth, as the doctor licensed in that state. Some of the larger networks can provide prescription coverage, with the exception, of course, of opioid narcotics. You have to do that in person. But yeah, and the convenience is amazing and probably can prevent an illness from becoming much worse. If you have a viral illness or a cold or something, you can jump on there with the doctor, and it's usually on a cash basis through your credit card that you would do it, but you're paying for the convenience.
Of course.
And the doctor asks some questions and do some vitals and so forth, and then can call in a prescription for an antibiotic or something, that would just be so much more convenient, especially like if you're talking about a sick child or something. You don't want to bundle them up and cart them into the doctor's office. So the fee that you pay for that is probably worth it.
Oh yeah, and especially people in like rural areas. I have friends in northern Michigan, and I mean, they drive an hour and a half just to get to work, just to drive another hour and a half to another site.
I know, it's just changed the whole face of healthcare in that instance.
Yeah,
for sure.
Yeah, definitely. So, we've seen machines in sci-fi movies that can, just diagnose medical conditions by, putting a little band on your wrist, things crazy like that. But do you think we're that far off of it? Like, could that be a possible thing?
I don't think it's that far away, actually.
Oh, wow.
I think, it's pretty soon we'll have the Star Trek holographic doctor taking care of us. But I'm still waiting for my George Jetson flying car.
I think
it's not here yet.
And especially the outdoor treadmill for the dog.
Yes.
Yes. That'd be best. That would be the best.
No, it's coming. Absolutely, it's coming. So. Yeah,
and like we've been saying the whole show, technology is new every day, and it's crazy.
Right. Oh, I know. I think of my grandmother and grandfather. When I went to visit them, my grandfather was a coal miner down in the Ohio Valley, and they didn't have an indoor bathroom until I was 12 years old.
Oh, wow.
We had to go up to the outhouse, so they never owned a car, and to see now, where we are at within a span of 100 years is just astounding.
That's crazy, especially like you said, we might have some of these sci-fi things one day.
Yes. Yes.
Well, that's all the time we have today. So Joyce, thank you again for joining us. You're always one of our favorite guests, one of the best people we've always had on.
Thank you.
Of course, you gave us a lot of great information, and you at home, if you have any questions at all or you want more information on today's show topic, give us a call at 248-288-2270 or send us an email at boomerhealth@americaremedical.com. Have a great day.